Good morning. We welcome you back to Talk Clarity. I'm your coach, Coach Clarity. We'll continue on with segment 2 on the neuroscience with trauma with Haley, the therapist from Trauma Agility. Is there a link between child abuse and medical conditions?
Absolutely. Absolutely. So ACEs, ACEs is the Adverse Childhood Experience Scale. And ACEs basically just gives you a number, and high ACE scores are linked to pain disorders, to autoimmune disorders, to chronic illness, mental illness. And so basically the higher your ACEs score is, the more that you're more susceptible to even homelessness. Like they've tied it to that, and there's a whole study on it. It's a huge worldwide study on ACEs and trauma and what it does to your body. And basically, if you're in a toxic environment and it's like constant toxicity, your body responds to that, and your stress goes up, and stress wreaks havoc on the body. And that stress and the cortisol with the stress, like those are the things that like really start to break down your system. And so you start with usually stomach issues, irritable bowel syndrome, gastric issues like GERD. You start to see like behaviors, regressive behaviors, and then it starts like with the depression and anxiety. And then it goes to maybe like you get sick because your immune system gets suppressed during stress responses as well. And then you start to develop autoimmune disorders in the severity, cases like rheumatoid arthritis, fibromyalgia. It's incredible on what your body can do to you, because basically you're a little child in there, and you develop this mantra during trauma of I'm not in control, and I'm not worth it, I'm not good enough. And so why would you want to stay in your body? Why would your soul want to stay in your body if your body is not good enough, if you're not good enough? So your body like literally starts to reject itself.
So I'm connected to a network of people, and have been for almost a decade, I'd say now, of people with pain syndromes. I mean, these are good people. These are nurses. These were doctors. These are kids that were dancers or in gymnastics, and just playing these different things. Very competitive, very intelligent, very active, very social beings. And then you're seeing at an instant something happens, and they'll say like an impact of like an example would be like cheerleading and an injury with cheerleading. When they fall down, well, that injury heals up, gets better, and then this unexplained pain that the medical community can't seem to figure out what's causing it, that is then being given a name. But there's not just one. The statistics with a lot of these pain syndromes are so high. They're so high. And I was actually just taking a look at it, just like researching brief, I didn't have a whole lot of time, but just the link between medical and pain disorders. I just put that into Google, and I briefly read that like fibromyalgia, complex regional pain syndrome, arthritis, somatic pain, it, and so much more, is linked to child abuse of some form.
Yes. Now, I'm not saying like all pain disorders do that, because I do feel like genetics are involved as well with some of those. But look at their trauma history. Look at the vets. Look at the vets who are developing these autoimmune disorders just up the wazoo. Like fibromyalgia rates are super high for vets. And that's where you get these sicknesses.
So is the brain creating these, and why?
Let me put it to you this way. And there's still a lot of research going on with this, but the brain, you can cause yourself to have a headache right now. Start thinking about, oh my gosh, my head hurts, my head hurts, my head hurts. You start ruminating about that thought. You start really like feeling it and starting to believe it. Your head will hurt. Your body can do so much to create chaos, and it feels like chaos. Your body, like there's like a huge link between like just verbal abuse with parents and like children developing like narcissistic personality disorder, borderline personality disorder, OCD, like paranoid person. Like it's just it's phenomenal what your brain can do, but it's also phenomenal what your brain can do to heal. Because
Right.
people have cured themselves of cancer just based off of their thoughts alone.
I've read that.
Mm-hmm.
I've read that. It's so fascinating. I think we really need to just dive into this a little bit more, just because when we're talking about 3 out of 4 children are experiencing some form of abuse, you're talking about 3 out of 4 children, um, likely responding with this, these unexplained medical conditions. And, it's real heartbreaking, because what I've seen, from individuals, conversations with, nurses that they used to practice, they can't anymore. And, they there's just so much mistreatment going on there within their own medical community, and not by all medical physicians, not by all staff, but certain people that don't understand or don't have the awareness, where they treat the individual like there's something wrong with them. They minimize their pain, they minimize their reality. They have a tendency to have them, they're told it's in their head. I heard one nurse say to me, and she's going, I used to take care of people, and I get where they're coming from, but this is real, and
Mm-hmm.
I'm in pain. And so, it's just so hard, because oftentimes you'll see, their own support system within their own family, that, some have described where family themselves have minimized it, or they'll roll their eyes at it, and I'll look at, there's the elephant that's in the room. There was a boy that was, I think, like 10, that I ran across, who was doing some infusions many
Mm-hmm.
years ago. And, with these infusions, he's just, it was just real heartbreaking when he was just, talking about the way that his family would minimize the pain and the reality of what's going on, and treat him like he was this elephant in the room. And it really struck a chord on me, because he wasn't the only one that I ran into. There were grown adults, there were adolescents, there were, as young as like 9. And I did connect to that community, just because I have some background in it, with, some loved ones. And because I was exposed to that, because I was able to see that, it really opened my eyes to a lot. But as we're getting into these numbers and these statistics, I'm sorry, but 3 out of 4. And so we've got a real issue going on here. What advice do you have for those suffering in pain, and, family or the medical community, um, from having just a negative perspective on them? What advice do you have, for these human beings?
And if I had a quarter for every doctor that I've heard like say, oh, it's all in your head, right? And I've worked with those doctors, and I've seen that happen. I don't think that all doctors are like that. I think that there's some really good ones that really do care. But two things, okay? We just came out of an opioid crisis. And I mean, that has been huge. In fact, like with COVID, like opioid overdoses are just insane right now. Addiction rates are insane right now. And so when it comes to pain, that's going to be like there's a social stigma surrounding pain, right? There's a social stigma surrounding mental health. Like only recently have we really just begun to change as a culture and say, okay, it's okay to talk about mental health. It's okay to talk about these things. And so, I mean, you have these two things, and it's very hard to treat pain because, I mean, I'm not a physician, But I know as a therapist, like I get a lot of people that are in pain and that are no longer in pain, once we go through the therapeutic process. And I think a lot of the time pain is mental. Pain can be, of course, like managed by medications and stuff. But what do these medications do? They block off the receptors for pain. And so I think getting down to the core issue, that would be my advice. And I have a lot of respect for the medical community. I did work with doctors, and so like I've seen some really phenomenal ones. Want their numbers, like call me. I know which ones go to, but I think working as a team to find what's really going on, what's causing the pain, what's causing the root issues, and instead of minimizing it, I would say let's work to find what's causing this. In if there's like no medical explanation for it, like all your labs come back fine, and MRIs are coming back fine, and everything's good and nothing's broken, like the medical community just kind of puts their hands up and it's like, I don't know what, medically further, I can't treat this patient. And so then they request the person to go to a therapist, and then it's my job to figure out, okay, so when did the pain start? So it was involved in a cheerleading accident, right? So your knee hurt, and then what happened? Oh, well, the girls like really bullied me. Boom. Okay. All right, we're getting somewhere. And then, so what happened when you had an injury to your knee? Like, how did you take it? How did you feel about it? Well, I was on crutches and people would make fun of me, or I was in a wheelchair and people would make fun of me. And I was, less than, like, I wasn't able to do what the other girls were doing. Like, that is a real, like a real heartbreaking thing to hear.
So something's happening though in the brain, because, these children aren't making it up what they're feeling. Yeah. They're feeling real physical pain. These grown adults are feeling real physical pain. So what is happening to the brain during that? Why is it responding like that? Why is the body responding to the brain like that?
Well, it's regressing. Brains can atrophy just like muscles. And so it's regressing to survival mechanisms. And so when you shut down the prefrontal cortex of your brain, then you're only operating out of your survival mechanism. And what's the survival in that scenario? It's to be needed, to be part of a tribe, because 1,000 years ago, if you weren't part of a tribe, what did that mean? You were going to die, right? We rely on people as tribes, as hunter-gatherers. And, the evolutionary rates are very slow these days.
Right. Wow. Okay. So I really wanted to tap into that just because my heart has gone out to that community, because the numbers are so high with different pain disorders. So important to talk about this and treat this as a real issue. It's a real thing that they're feeling. And if we can address their symptoms, what's going on, and like you mentioned, get to the root cause of it, but we can approach it, society-wise, as this is a very real thing. How are we gonna like empower and come together and support this person to help bring them out of this? Because something's obviously happened.
Yeah. Yeah.
And I'm not surprised with how high the statistics are with different pain disorders when you're talking 3 out of 4 children by the ages of 2 to 4. So, this gets into a next hot topic that I wanted to get into, with the brain and the way that it's reacting, mental health disorders and the mental health community. Mm-hmm. I was actually reading a study. It said any mental disorders among adolescents, and so it was based on a diagnostic interview data from National Core Mobility Survey. Did I pronounce that right?
The what?
Core
morbidity?
Yeah, say that word for me.
Oh my goodness. Comorbidity.
Thank you. I was trying to figure out how to pronounce that.
It's one of those words that it's like.
So it was a survey done for adolescents, and it's in figure 5. You can go find it. In fact, I'll attach it to this.
Mhm.
But it showed that, and this is age ranges of 13 to 18, and it said that it's estimated that 49.5% of adolescents had a mental disorder. And of those adolescents with mental disorders, it's estimated that 22.2% had severe impairment.
Jeez.
Haley, the therapist, I'm going to let you lead the floor with that because we're talking about mental health disorders now. We're talking about 3 out of 4 children.
Mm. There's so much I can say on mental health disorders. And even like if it's not a disorder yet. So here's what I've seen. I've seen people go through traumatic incidences like 9/11, and if they were open to processing the trauma early on, the lasting effects weren't there. Versus somebody like vets, like Vietnam vets, they don't talk about it. They just keep it hidden. And honestly, that was my issue too, is that I kept it hidden. And the longer you keep it hidden, the more progressive and severe that it gets. So when you're talking about like borderline personality disorder, narcissistic personality, cluster Bs, right?
What's a cluster B? I'm sorry.
A cluster B is, sorry, it's in the DSM-5. It's a diagnostic statistics manual that we use. And a cluster B just refers to the personality disorders. And what we know about personality disorders now, and of course, like this topic is huge. Research is continuing to grow and to just be studied on so many different levels. I mean, there's chemical trials going on for this right now. You can look it up, like MAPS and stuff. They're working with the veterans who have completely have gone nonverbal, like they can't function, they can't go out in the community, and they're isolative, and like 3 out of 4 are being healed, like through psychedelics.
Wow.
Yeah.
3 out of 4?
3 out of 4. Yeah.
How do we plug into that?
Well, so right now the MDMA trials are still in their clinical phases. I believe they're going into phase 3 right now. For ketamine and for marijuana and for psilocybin, marijuana is becoming legal. I mean, I know that Utah has a medical marijuana program. They have a ketamine program. They have a psilocybin program. And so we can hop on psychologytoday.com and look at the different, therapists and psychiatrists. And typically you have to have a psychiatrist that will prescribe these medications to you and have it in conjunction with therapy. And that is the most effective. And just results have been absolutely just phenomenal with that.
How new is this?
Not new. Not new. Actually, so there was a book that I just read. It's called Be Here Now. And he's a psychiatrist. The author was a psychiatrist who was at Harvard in like the psychedelic phases. I think it was like the, don't quote me on this. I'm terrible at history timelines, but I think it was like the 70s where like drugs were all the rage, right? And they started doing these unethical trials of the drug LSD. And it was healing a lot of people. And he actually got kicked out of Harvard for it, like kicked off his seat. Yeah. So, I mean, it's not new. We've known about it for a long time. If you look at ancient populations in the Eastern culture, like they use opium, right? Native Americans used, let's say, psychedelic drugs in order to get to a higher state of being. So, I mean, it's not new, but it's starting to become wildly acceptable. And it's starting to be really studied on a scientific level. And then they're starting to see the effects of the science. And then they're starting to agree with it because science doesn't really lie in this case.
So I mean, you're talking about taking a chemical is really what it is, and it's almost like rechanging the brain's chemical that was unplugged.
Yeah. Yeah. So you're rewiring your neural pathways is what you're doing. So, and there's still like some questions on how this happens, but like ketamine activates the glutamate receptors, right? And psilocybin does as well. So MDMA, they're saying like it almost turns on like all the faucets and allows you to create like oxytocin, and you can bond and you feel more safe. And so basically that's what these drugs do, is it makes you feel more safe to talk about your trauma, because one thing that we know about trauma is that if you don't feel safe, you just shut it off, because your brain has several different fail safes and your body has several different fail safes. So if you experience too much trauma, it's like overload. It's like overloading your circuits and just electrocuting you, because your brain is electricity. So there's a bunch of fail safes in there so you don't do that. And that's why you see some people, they just have mental breakdowns. They call them like mentally insane. They start to have like schizophrenic, you know, visions and stuff like that. Like those are the extreme cases where the fail safes in the brain failed to work, and they were overloaded. So when you see like severe trauma like that, you it's a systematic process. You really have to know what you're doing in order to unravel that trauma to work on it.